I'm Doris Hansen. Today I'm at ASCO. I'm presenting idecabtagene vicleucel, the real-world experience. This was a multi-center observational analysis of patients planned for standard of care ide-cel infusion at 11 U.S. medical centers. Essentially, we had 196 patients that were leukapheresed, and of those patients, 159 were infused. 77%, or 150 of our patients, would have been ineligible for participation in the KarMMa clinical trial. Most common reasons would have been organ dysfunction, poor ECOG performance status, cytopenias, or prior BCMA exposure. Essentially, despite a lot of our patients being ineligible for trial, this did not appear to impact efficacy. So the median progression-free survival for our patients was 8.9 months, or at least the projected with our median follow-up. And in terms of overall response rate, that was 86%, as you see here. And then CR, so a complete response or better, was 42%. And of the patients who had a CR or better, our minimal residual disease negative status was 78%, which was similar to the trial. Safety was also very similar in terms of high-grade cytokine release syndrome and neurotoxicity. Any grade neurotoxicity was 18%, which was exactly the same as the trial. Grade 3 or higher was 6 versus 3%. CRS, or cytokine release syndrome, was also very similar, 82 at any grade versus 84%. Grade 3 or higher was 3 versus 5%. We did do a multivariable model looking at what predicted for inferior outcomes, and we found that prior exposure to BCMA-targeted therapy does appear to be an independent predictor of inferior outcomes, impacting best response or better, as well as progression-free survival. And then patients with high-risk cytogenetics also had an inferior survival.